Hi everyone, my name is Harmony Smith and I'm going to be talking about Yolanda's current performance, specifically her performance patterns and her performance skills. These are all things that you're basically going to find during your evaluation or things that you'll see once you're started to build rapport with your client. And so this is just a very brief overview of the things that you might find. So beginning with performance patterns. Yolanda had many roles and routines that she was accustomed to prior to her accident. These roles that now have been affected include being a wife, being a mother, and being a homemaker. Her affected routines that she just went through her daily life with include dressing, cooking, and grooming. So the role of OT in addressing those roles and routines that have been affected so much, basically the priority is going to be to have her return to previous level of functioning. Previously, Yolanda was completely independent in all of these things, and now she has stated that she's not as independent as she was, and she doesn't want to rely on other people except her husband. So the best thing we're going to do is get her back to that state of independence, whether that's through improving her range of motion, her strength, or just overall strategies that we can help Yolanda with to return back to her PLOF. However, there are some barriers that Yolanda may be experiencing because of that we found while looking at her evaluation. So we decided that her barriers would include memory. It stated in the client story that Yolanda might have memory issues, like she's very forgetful. So this means as therapists, we might not be able to trust everything she says right off the bat. Another barrier is Yolanda has fear of maybe trying new things. The shower is currently kind of scary for her, so that's something we might have to build up and work on. And then Yolanda is also experiencing pain during shoulder flexion, so that is something we also need to be aware of. However, Yolanda does have strengths that will help her during therapy as well. One being her motivation. She is very eager to get back to her way of life before, and she's actually going on a vacation soon. So that is perfect motivation so that she won't have to be um, depending on others during this vacation. In addition, she has family support. She does have children and a husband. And it also stated that Yolanda was very personable, so this might be helpful in establishing rapport with her. So it stated one of the questions was that Yolanda has a history of alcohol abuse. Is this important to know? And if so, why? Well, this is a very personal matter, but we all believe that yes, this is an important thing for us to know as therapists because Yolanda currently claims that she does not drink alcohol, but her accident is a major event for her and that has changed her life probably dramatically. And knowing her history and things like that is important to know because you can be on the lookout and see if any of those signs of alcoholism or depression or anxiety, things that might happen after a major life event, you can be aware of those things. And if you do notice them, you can make the proper referral to whatever mental health or health professional you need. So, the next part I wanted to talk about is her performance skills. We looked at 10 performance skills that were barriers. So this means there are 10 performance skills that right now Yolanda is not doing too well in. So the first one is reaches, coordinates, moves, lifts, transports, flows, clarifies, endures, replies, discloses. So these are all skills that you might have noticed that Yolanda had trouble with during your evaluation or just general observation. And you're going to take note of that and you're going to be like, you might not think about this straight up, but in the back of your mind, you'll be thinking about these once you're writing the interventions or the goals. And so Yolanda also has some things that are supportive for her. So her skills for these would be heeds, chooses, uses, handles, inquires, initiates, terminates, accommodate, searches slash locates, and gathers. So being able to keep in mind what the things that Yolanda is able to do is a good way to incorporate that more top-down approach rather than just looking at all the things that she currently cannot do. We want to look at the things she can do as well so that we can help her be as productive as she can in therapy. So the next thing is her self-care deficits. She has problems with showering, dressing, and grooming. So with showering right now, she doesn't even want to attempt it. So that's something we probably will work more towards later on. And then just with dressing and grooming, she is dependent. With grooming, she's figured out like certain things that we'll talk about a little bit more later, but she still needs help with them. So, how are we going to address these things? Well, we want to do, of course, functional based interventions for Yolanda to practice. And we'll talk a little bit more about this later on in the videos, but she will also need to increase her range of motion to even get to be able to do those functional based interventions. But for things like grooming and her makeup and washing her face, like we want her to actually practice those things, dressing as well. Like she needs to be able to actually engage in those activities because those occupation-based activities are usually what is the most effective for patients. In addition, it's important to use the encouraging mode to help Yolanda try new methods. Like she is hesitant about the shower, so once you have established that good rapport with her, you might be able to introduce that and start talking about it and use that encouraging mode that we've learned in professional reasoning to help Yolanda try and attempt new strategies. So here's a little scenario. Yolanda is unable to apply her eye makeup, eyeshadow, eyeliner, and mascara because she needs both hands to do this. So Yolanda was obviously completely independent with these things before, but now after her fracture, she's having difficulty doing this one-handed. So first, let's break this down. So what performance skills are affected? Specifically, her motor skills. So stabilizes, moves, reaches, lifts. So these are all probably going to apply mostly to that fractured hand or fractured arm, I mean. And then the process skills that may be affected are uses and adjust, just based on what we observe from Yolanda and how she's dealing with those other motor skills that were affected. So how might you address these grooming tasks? Once again, we probably would like to simulate the activity as best as we can. We may come up with strategies to help her with applying those makeup traditions with one hand only. However, we do recognize that this will be difficult without that shoulder flexion in terms of her being able to do it with both hands. So we're going to work on range of motion, specifically shoulder flexion, and hopefully with that, then we can come up with some other ideas if need be. Right? Thank you for listening, and the next part is coming up.